Welcome back, YouTube. I'm Alex Grodzicki. I'm a student physical therapist, and today we're going to be talking all about shoulder impingement. Before we jump into today's video, I want to remind you to subscribe to the channel so we can continue building a community of people to help everyone with their aches and pains. Shoulder impingement is a common diagnosis that many people see in the clinic. Today, I want to go over why it's painful and some of the tests that we do as physical therapists to see if this is what's causing your pain. A common movement pattern that's painful for many individuals with shoulder impingement is lifting their arm up to the side like this. Let me show you why. Due to the anatomy of the shoulder, there is limited space in the joint. So in order to have full motion, the shoulder blade needs to move with the arm. When they don't work properly, it can cause for muscles to get pinched between bones and structures and cause pain. Now, here's a few tests that you can try at home to see if shoulder impingement is causing your pain. A quick disclaimer. These tests might replicate or increase your shoulder pain, and if they do, it could indicate that you have shoulder impingement. Now, you don't want to rely on just one test, so the more tests that are positive, or in other words, replicate your shoulder pain, the more likely you have shoulder impingement causing your pain. For the first test, I want you to point your thumb towards the ground throughout the entire movement and slowly lift your arm overhead. Be sure to compare it on both sides. And if this replicates your shoulder pain, it could indicate that you have shoulder impingement. For the next test, put your hand on your opposite shoulder. Slowly lift your elbow towards your forehead. Make sure you compare both sides. If at any point of this movement you have the replicated pain in your shoulder, it could indicate shoulder impingement. Make sure you don't push through the pain. For the last test, put your palm on your opposite elbow, kind of like a modified Macarena pose. Then use your underarm to slowly elevate the upper arm. Make sure you test both sides. If this replicates your shoulder pain, it could indicate shoulder impingement. If you've had shoulder impingement in the past or are currently dealing with it, please comment below to let us know what's working best for you. This will help the viewers as well as create a community of people to help everyone learn more about their shoulder pain. I want to invite you all to the PT Grodzicki community where we help everyone learn about their aches and pains. And if you got value out of today's video, make sure you hit that like and subscribe.